Tonight's original now with in-depth reporting on a topic we've been keeping an eye on. Nearly 80% of kids' hospital beds across the country are full. And in 4 states, it's more than 95%, Maine, Kentucky, Utah, Arizona. That's because RSV, this kid's respiratory virus, is sending so many sick kids to the hospital. And with flu season starting to surge, on top of the pandemic, you've got hospitals nearly at capacity. And you know what? Doctors, they are feeling maxed out, too. A new survey shows just how stressed primary care doctors really are. NBC News Medical Fellow Dr. Akshay Syal has the story.
The way I identify burnout in myself is the things that usually bring me joy kind of don't anymore.
Dr. Hani Chabo has been a primary care doctor for 6 years.
I absolutely love my job and I love being a doctor. But some days I know that when I'm burned out, I kind of lose that connection a little bit.
A majority of doctors around the world are experiencing stress and burnout, according to a survey from the Commonwealth Fund of more than 9,500 primary care physicians.
There was a time where I would come back every day and talk to my partner, and the first thing I would think about is, am I in the right career? For me, that was a very confusing time because I had spent, 12 years to reach where I am today.
In the U.S., 58% of primary care physicians reported their job was stressful, 54% reported emotional distress, and 44% were burned out. And those doctors say the quality of care became worse during the pandemic.
We know that, at least in the United States, primary care is a very difficult profession to pursue. It's undercompensated, overworked, underrespected. We need to pay primary care physicians adequately compared to specialty colleagues. We need to relieve them of the unrelenting workloads that they so often have, the hamster wheel of new patients every 15 minutes.
By 2034, the United States could have a shortage of up to 48,000 primary care physicians. And more than 1 in 4 who are leaving blame burnout. But most primary care physicians with emotional distress do not seek help. Dr. Chabo, he believes therapy made a huge difference.
I did seek therapy at that time, which was very helpful to me. I would say that was also one of the biggest things that saved me during that time.
He's the medical director of well-being at the Ridgecrest Regional Hospital in California. He's working on different projects aimed at improving culture, workflow, and team dynamics.
We tend to want to deal with it ourselves. We make the worst patients.
A good first step, acknowledging the problem.
We do normalize burnout a lot in healthcare. And I think one of the most helpful things is to talk about being burned out, share, be vulnerable. So if you have the energy and the motivation to be more involved in improving your environment so that burnout is less of a system issue.
Dr. Syal is joining us now. And doctor, I can't help but think as I listen to that story, you've got doctors who are burnt out. You've got a tripledemic, potentially, right, with RSV, the flu, and COVID. Those two things, the collision of those two things feels like a not great situation for parents and their kids and anybody who gets sick.
Yeah, good evening, Hallie. Exactly. I mean, you said it perfectly. It's a not great situation, and that's, one of the reasons we wanted to do the story here for you today. Part of that survey was asking doctors, has the quality of care that you offer patients suffered because of the result of your burnout? And unfortunately, a lot of them said yes. And, when you talk about 3 viruses that are potentially surging this season, you want to make sure that doctors are able to take care of patients, and they can't do that if they're not taking care of themselves. So it's a really, really good idea here for all of us to just be more open about it. And like Dr. Chabo said, acknowledge the problem. And if you do have an issue, please seek help. There are things you can do about it.
Yes.
It's unfortunate. Young doctors are the ones who are more likely, like Dr. Chabo, like myself, frankly, the ones more likely to suffer from these things.
The good thing is I feel like generationally there's much more of a destigmatization of the idea of let's just treat therapy like going to the dentist. We say it all the time on this show, right? That's a thing that people should be doing, and it's not a weird thing. I'll get off my soapbox, Dr. Syal. Thank you so much.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.